Hello, everyone. Sorry for joining late and coming late to the class. I tender my apology for that. Please pardon me. Once again, I want to welcome us to NAC 515 facilitation class today. I'm excited to be in your class today, and I want to believe we all had a lovely day so far. Today in our online discussion, we will be looking at Module 4. Module 4, Unit 1 and 2, that is what we will be considering. And next week will be our final week, which will be week 8. And we'll round up with Unit 3 of Module 4. Module 4 is actually the last module for this course and this semester. And Module 4 has 3 units under it. Today we will be covering Unit 1 and 2. And next week, by God's grace, we'll cover Unit 3. Then we'll have a kind of feedback from students and interaction in preparation for your exam. So I want to quickly go into the lesson for today and allow me to share the slide that I've prepared for this unit. I've introduced the topic, which is integration, industrial legislation and labor organization, Module 4, Unit 1 and 2. What are the learning goals for this unit that we are covering today? We have the following learning goals or learning outcomes for Unit 1 and Unit 2. The following are the learning goals for these 2 units: to identify the professionals involved in the evaluation of occupational health, to enumerate the functions of professionals involved in the evaluation of occupational health, to be able to describe the concept and process of rehabilitation, identify those involved in rehabilitation, and lastly, identify the principles of rehabilitation. So we quickly look at health professionals involved in evaluation. The evaluation of occupational health program would not be completed without the functions of other professionals apart from the nurses and the doctors. Who are other professionals who are involved in evaluation when it comes to occupational health and safety issues? We have the safety engineer, we have industrial hygienist, we have recreational and occupational therapists. We also have occupational epidemiologists, and lastly, laboratory technicians. We look at the function of each of these professionals in evaluation of occupational health and safety. The safety engineers, they take record of injuries and investigate accidents which have already occurred. They use the statistics to advise management on how to avoid the occurrences of such accidents. If an accident happened, they use the statistics and advise management to prevent the reoccurrence of such an accident. They also identify and evaluate hazardous conditions and practices. They develop hazard control designs, methods, procedures, and programs. Those are the functions of the safety engineer as a professional and his role as in occupational health and safety. We looked at industrial hygienists. What do? They actually participate in pre-planning for a major accident. They evaluate and control health hazards in the workplace from biological, chemical, and physical sources, advising on developing and implementing appropriate personal protective equipment to minimize exposure of workers to hazardous hazards and risk, and prevent them from being exposed to risk. Occupational epidemiologists. Occupational epidemiologists study the occurrences of disease symptoms among factory workers. The study of epidemiology itself in the workplace actually is to do a kind of distribution, to study the distribution of disease and injuries among a population or in a community or in a particular area. And mostly this study happens in a more particular area, maybe in a workplace or in an industry or in a community. And the study of factors that affect these problems, they want to look at it. What is predisposing people or this person to these problems? They want to identify the factors or the predisposing factors to this problem or illnesses, in order to be able to provide an intervention that will prevent further occurrences. So that takes us to the next topic, which is Unit 2, and it is titled Occupational Rehabilitation. Feel free to raise your electronic hand if you do have questions or you want to contribute to what we are discussing, considering that you've gotten the material earlier on, and I believe you have gone through it. Rehabilitation is a dynamic, health-oriented process that assists a person with disability to achieve the greatest possible level of physical, mental, spiritual, social, and economic functioning. Rehabilitation is an integral part of nursing because every major illnesses or injury carries the threat of disability or impairment, which involves a loss of function or abnormality. A person is considered to have a disability when there is a restriction in performance of everyday activities, and the goal of rehabilitation is to restore the person's ability to function independently. So we look at the teams that are involved in rehabilitation. For those of us that work in the psychiatric department, who understand this topic very well, and you will relate to it very well when it talks about team treatment to a patient. And so we have rehabilitation team. Rehabilitation is a creative, dynamic process that requires a team of professionals working together with the patient and the family. And the team members represent a variety of disciplines with which health professional making a unique contribution. Each health professionals assess the patient, identify patient needs, within the discipline's domain and set rehabilitative needs and set rehabilitative goals. The team members hold group sessions at frequent intervals to collaborate, evaluate, progress. They want to look at the progress that has been made so far. They want to see where they need to modify, where there is need to adjust, and so on and so forth. And all this is to promote independency to this. Sorry about that. Please, if you are not asking a question or contributing in class, remember you are in class, please. And so we have process of rehabilitation. Process of rehabilitation. The individual is taught on how to adjust to the disability by learning how to use resources and to focus on existing abilities with emphasis placed on ability, not disability of the person. So it is very important that when a rehabilitation session is going on, you want to emphasize, you want to drive home to the individual the importance of ability. What is the strength of the person? Where does the person still have strengths? And just take the person's mind from his or her disability and let the person focus on her strength despite the injury that has occurred. And nurses are expected to provide health promotion, education classes that are targeted to the disabled. Educate on nutrition. When nurses are giving education, there is emphasis on nutrition and weight management. Of course, we know that nutrition plays a vital role in the building of a person. And so to the individual who is disabled, there will be need of modification in the diet or nutrition of the person, as well as the environment of the person. The rehabilitation team will include the patient itself, the patient's family, the rehabilitation nurse, a physician, psychiatrist, physical therapist, occupational therapist, speech language therapist, psychologist, social worker, vocational counselor, rehabilitation engineer, and sex therapist. These are the individual professionals that are involved when there is a rehabilitation program going on with an individual. And before we look at each of these, the importance of their role, let me stop sharing my slide and see those of us who want to add or ask questions from what we have covered so far. Let me say a big thank you to those of us that managed to come online and are present in class. I must say, and I've always said, that I crave for your contribution. I do say that this is not a lecture. This should be a facilitation. When we say facilitation, it means that it is student-centered. You are supposed to talk to me when we come online. Before we come online, I've submitted the instructional video, and when we come for this 1 hour, it's for you to talk back to me. You tell me what you read that is not clear. We interact together. You bring questions. But when you allowed me to, when you don't ask questions and I continue to read, we've turned it to lecture. Please, you're welcome to share your understanding or ask questions. Let's interact now. Let's interact. Who wants to share? Let me see your electronic hand. If you have something. Okay. Inyoma. Okay.
Hello. Good evening.
Okay. Fine. Speak on.
Good evening, ma.
Good evening.
My own is not actually question like that, but it's yeah, TMA. There is confusion there.
Okay, let's hear it.
Yes. There is one question. It's about the team members of occupational health. So there are lists. We have an occupational health nurse. We have a physician. We have a community health. But with what we have gathered from our book, me personally, I noticed that CHOOS are not part of occupational health team. Then when you answer it, the system will mark you wrong.
Okay. Well, you can say anyway. So what's your question now? Let me get it.
So my question is, because to me, I conclude that there is a wrong, they are marking it wrong.
Okay.
Maybe is it from the people that put in the questions or what? I don't know anyway. But because from what we have read in this material, community health workers are not part of occupational health team.
Yes, they are not.
They are not. Because that question said occupational health team includes except, you understand?
Yes.
Except which is community health extension workers. But when you answer it, they'll mark you wrong.
Okay, well, we'll have to, let me speak to the HOD concerning that, then I will come back to you.
Okay.
All right,
Okay.
Thank you for bringing that up. Who else has something to say? Okay. Oluyemo. Oluye.
Oluyomi, ma.
Oh, sorry, my apology for pronouncing your name wrongly. Oluyomi. All right, please, you have the floor. You have the floor. Oluyemo, you have been given the floor.
All right, ma. Please, ma, from when I was going through the course material, okay, I discovered that
is it your network?
The health professional gave us. I just speak it. Those are the only people that are involved.
The what?
In evaluation.
Yes.
I said that when I was going through the course material, you asked us to go through the health professionals involved in evaluation and rehabilitation. So when I was going through it, I discovered that there are about 9 of them. But now you shared 5 of them with us.
Yeah.
So is it that it's only 5 or you just took those ones to explain to us?
I just choose those ones. You know, this is 1 hour. I can't bring everything. What we share in this 1 hour is like a summary, a concise of the topic. So that is why the material, the course material and this one is there for you to put together.
All right, ma.
Yes.
All right. Thank you so much.
You're welcome.
Yes, ma. And then again, ma, concerning the assignment, the assignment is supposed to be due tomorrow. But those of us that submitted today said we are 1 day, some hours late. I don't know why the portal is saying that to us.
But were you able to submit?
Yes, ma.
No, as long as you submit, it won't affect your grade.
All right, ma. Okay.
It won't affect your grade. Please encourage others also to submit.
Okay, ma.
All right.
Me too, ma. I've submitted, but you keep on telling me you have not submitted.
Okay, what's your name? Let me check. Because
My name is
only 38 students submitted.
I've submitted, but you keep on telling me you have not submitted. My name is Norma.
Okay,
Norma Endurance.
Okay.
Norma Endurance.
Okay.
My matric number, NOU 17.
Okay, don't worry. Your name is in. Okay, I can get another student that will be in Norma. What's your number?
NOU 1710 35588.
35588. Thank you.
Hello, ma.
All right. Inoma, that is sorted. I would take note of that.
Okay, ma. Thank you.
Okay.
Hello, ma.
Mary Jane.
Hello, ma.
All right, speak on. Who am I speaking with? Who is speaking now?
Omalekan Titilayo.
Okay.
Yes, ma. Thank you, ma, for your support. Ma, my issue is similar to that of the last speaker, ma. I submitted too, and it kept on telling me that I've not submitted.
Okay. Omalekan
Titilayo.
Titilayo.
NOE 1720 22.
1720.
1710 21 022. 1710 21 022.
22. Okay, it's noted. I will check.
Thank you,
I've
ma.
only seen the numbers. I've
Thank
seen, I think 38 so far.
Okay, ma.
That I've submitted. So I will look out for the names so that when I didn't see it, I can probably check. But before we meet next week, I should have created time to grade the assignment. Then I will get back to you.
Thank you, ma. I submitted under that comments column.
I will say, I will check
Okay,
and let you know.
Thank you, ma. God bless
Who
you.
else? Who else has something to say or question or contribution?
Good evening.
Good evening.
Good evening, ma.
Good evening, Beauty. Your line is breaking.
I don't really know. I'm in office. Do I went inside the office? Please,
Can you send a chat
having issue
because we
to
can't
submit
hear
this
you
thing.
audibly.
Okay, I said I'm having issue submitting the assignment.
What issue are you having?
Did you hear me?
What issue do you have
you
or
hear
are you
me?
having? The issue is your line is breaking. Please send us a chat and we'll get back. So who else has question or contribution? Okay, if there is no question or contribution, we are going to end the meeting now.
Sure.
In the absence of question or contribution, please, I want to encourage us, for those of us who have not submitted our assignment, please let's do so before the end of this week so you don't miss your mark. And I want to acknowledge the effort of Janet Alao for the good job that he's doing, accepting to be the class rep for this course. Thank you so much. And I see the chats and what's your response and everything. Thank you so much. The WhatsApp group will be updated with the previous instructional video. For those of us who have not managed to have it, you can have it. I can see your electronic and Infinix Hot. You have the floor.
Okay. Good evening, ma.
Good evening.
Yes, ma. Thanks for today's lecture. It was very educative. Thank you so much, ma, for your effort. God bless you.
Amen.
Ma, concerning the assignments, I was not in class yesterday because I was at work and we were very busy, so I could not have access to my phone. So I don't have any idea of the assignments.
Okay. The assignment is on the page, is on the student portal. And why we are not posting the assignment here, because it will not help you. It's better you open your student portal, you will see the assignment there, then you can respond and submit it back on the student portal. That is the appropriate channel for you to access the assignment and submit the assignment. It's on the VLD. Please.
Okay.
go
Okay,
there.
I've been trying to open it. I guess maybe network or school. I've been trying to have access to it since
Okay.
morning.
You can also relate with any of your colleagues and
Okay,
ask them how they have been able, if
Okay.
you rule out the issue of network. I think Janet
Okay.
can assist. Drop a chat on the WhatsApp group and ask for assistance. Let's see who will be able to assist you on that.
Okay, ma. Thank you, ma.
Thank you.
You're
Idowu,
welcome.
Hello, ma.
you
Yes,
have the floor.
Yes, I was the one that just spoke now.
Okay.
Okay, hello, ma. Our last lecture, I dropped my WhatsApp number. You say you are going to have a WhatsApp group. I've not
Yes,
seen
indeed.
I've not seen myself in the group.
Ibo. We started the group since last week. So
I dropped my number. I didn't see myself.
okay. So Janet,
It's not.
you said we lost you.
Yes, ma'am. Please let her drop the number again, ma'am.
Please, can you dictate your number? Let the admin, the class rep, take note of that.
Hello, ma. Hello, ma.
Idowu,
Yes, ma.
please tell us your number so that we can add it. Okay, I can see Ishaya too also has the same complaint. Okay, I'm copying. I'll just if you know that your name has not appeared on our WhatsApp group, please drop your number now. I will forward it to the class rep. Then she will add you to the group. Okay. All right. Who else? I see Infinix Opt. Is it that you
Yeah,
cannot
hello,
lower
ma.
your hand or you have
Hello,
another
ma.
question? Okay, speak
I'm
on.
the Infinix Hot, ma.
Okay.
This is Sophia from Lafayette Center, ma.
All right. What's your question?
My own is still on the WhatsApp group. I've been waiting for the WhatsApp group. Up to now, my name is not added, ma.
Please drop your number again. Let's
On the chat bar?
On the chat now, please.
Okay,
drop
ma.
it.
It's okay, ma. Thank you.
And drop the correct number, because for those of us, majority of the people that drop their number, we've already added them. The class rep is listening now. So who else has? Okay. Okay, you have the floor, Maria. Miriam. Sorry. Please, can you unmute yourself? I've already unmuted you here. Unmute yourself. Miriam, we can't hear what you are saying. I've unmuted you here. Kindly unmute yourself. Okay. Ido, do you still have something to say? If not, please, can you lower your electronic end?
Okay. Sorry, ma.
Oluyomi, you have the floor. Okay. For those of us who are complaining, a quick announcement, please. A quick announcement. Please kindly use this number and join the WhatsApp group. It's 070 55 62 990. Kindly use this number to join the WhatsApp. 070 65 56 2990. Thank you.
Hello, ma.
Who am I? Okay, speak on.
Ma, please, ma, when I was going through the medical laboratory scientist and the laboratory technician, their works look somehow similar and somehow confusing, ma. Please, ma, can you differentiate between the two, ma?
Laboratory.
Medical laboratory scientists and laboratory technicians.
Of course, we know that from the word, though their work looks similar, but it is not the same. A technician is different from a scientist.
All right.
So when you say you're a lab technician, you do more of the equipment that is being used. But who operates that equipment are the lab scientists.
Okay.
You get. So that's why it looks similar, but it is not the same. The lab technician.
Okay, ma, can I say?
You said?
Can I say that the lab technician looks like the unskilled workers, or the workers at the factory level, something like that?
Yes,
those
at the factory level. Yes. Yes, but you can't call them unskilled. They are also skilled.
They are also skilled. Yes, that's why I changed my words to say factory. Those that are at the factory level, those that are actually working.
Yes.
The lab scientist, the medical lab scientist looks like the one that is giving them what to do.
Exactly.
All right, ma. All right. Thank you.
Okay. Beauty, I've seen your comment. Your network is a bit problematic. But if it's clear now, let's hear your points.
I was saying that I had issues logging into the portal. They keep telling me wrong username, wrong password.
I'm afraid I may not be able to assist regarding that. I suggest that
Did you
you
hear me,
meet
ma'am?
with the university ICT group. They'll be able to help you. And you can also drop this question you have on our WhatsApp group and see if any of your colleagues will be able to assist or guide you on how you can log in. Are you part of our WhatsApp group?
Yes, ma'am.
Yes, please raise it in the group and let's see if any of your colleagues will be able to assist regarding that. That is another purpose of the WhatsApp group, for us to be able to assist each other. We understand that not all of us are in the same level when it comes to technology operation. All right.
Okay, ma'am. Thank you.
Miriam, I've
my next
recognized you.
please.
Please, you have the floor.
Ma'am, you promised to send us module 1 to 3.
I will do that. I've not had chance to sit down and post them. As soon as I'm able to create time, I will definitely do as I promise.
Yes, all right. Thank you very much, ma'am.
You're welcome.
God bless.
Amen. All right. Any other question or?
Yes, ma. Adeotola, ma.
All right.
Ma, the question I have is the occupational therapist and the physical therapist, their work looks somehow similar.
Okay.
Hello, ma.
I can hear you.
So, all right, ma, I said the occupational therapist and the physical therapist, as we have in the course material, their work looks somehow similar.
Yes.
But what I could
continue.
I said, but what I could deduct is that the physical therapists, they say they focus primarily on neuromuscular and then range of motion, something like that.
Yes. I was about to say that the role of occupational therapist, physical therapist is more of a physio, more of a physio work.
Okay.
Yes. So most of these roles, just like we and the nurse, just like nurses and doctors, you will see most of our roles look similar. And you can see that, yes, so the same thing in other professionals. You will see that what they do are actually very similar.
All right. Okay, ma, thank you so much.
Which number, Janet? Yeah, one of the students is complaining that this number is not, the number you gave is not on WhatsApp.
Is there 07065562990?
All right, you've all heard the class rep. Please, we check the number, is there on WhatsApp group. Some of us are already part of the group. So you need to recheck what you type. So any other question, complaint, contribution? All right, I think we can end the meeting here if there is no further question or contribution. As I promised, I will still post all the lessons on our WhatsApp group for us to have access to it. And I want to say, okay, Oluyomi, you have the floor before we end the class. I can see your electronic end.
Sorry, I muted myself. Ma'am, my question is, what is the difference between safety engineers and then the industrial hygienists?
Yeah.
The difference between
busy.
safety engineer and industrial hygienist.
There is a background noise where you are. Please come again.
I said, ma, what is the difference between safety engineer and industrial hygienist?
Okay. When you say safety engineers, they mostly work in the factory.
Okay.
You mostly find them in the factory. And for the hygienists, they deal more with the sanitation of the environment, whether factory, whether company, as long as it's a workplace, they do more of the hygiene of that environment, because a poor hygiene can cause hazard to the employees. So that's the difference between them. And when you say safety engineer, they deal more with the technical aspect of work. But an hygienist look at all aspects of the environment of a workplace.
Right, ma'am.
So thank you all for today's participation. I think this is where we will end it today. If there is no further question, all right, we'll see next week by God's grace. Next week we will only have unit 1, which is the last unit under module 4. Then we will have interaction. Come with your question, and that will be the end for this semester, the end of our meeting for this semester. Thank you. God bless you. See you next week, same time. Bye.